I'd like to acknowledge the traditional owners of the land we are meeting on today, the Cabral people of the Great Darug Nation. I also acknowledge and pay my respects to Aboriginal elders past and present and extend that respect to Aboriginal people here today. So if you've not attended a REDTalk before, Corinne's going to give us an update of the project so far and where we're up to, but also at the end you'll have the opportunity to think of a question or a comment you might like to make, and you can put that in the chat as part of the Teams, and then we'll attempt to answer that for you. So I'm going to hand over to Corinne now to give you an update. Thank you.
Thanks very much, Scott. So just a quick project update. So decans into the ISB are now complete, excluding ED. So ED will happen early next year. We've also commenced the works in ED around the corridor connection. So that's also due to finish early next year. We will then, once that corridor connection and ED have moved into the ISB, we will then commence the ED phase 2 refurbishment works. And they will go for approximately 9 months. We have also completed the MRI and CT from radiology. They have successfully relocated into the new building, which has been a fantastic piece of work. We've had interventional radiology, and our new theatre has been handed over, and we've now commenced the theatre's staff station refurbishment. They will also commence general services refurbishment in the basement in the new year. And as I've said, lots of refurbishment works happening, and what we're going to ultimately hear from that is lots of noisy works. So people may have experienced this already, but they will be quite high, especially leading into Christmas and early in the new year. Also thought we'd just share a few photos from all of the recent moves over the last couple of weeks. So the first baby born, travelling into the new NICU, and our first baby in the new NICU. And then just some more pictures from our antenatal assessment unit, women's health outpatients, and maternal fetal medicine unit. Also thought I'd just give everyone a reminder, and if you haven't walked around the outskirts of the northern part of the campus, you might actually see the hoarding has started to go up, but entrance L and N will close along with the drop-off zones at Campbell and Forbes Street on the 16th of December. So that's no vehicular or pedestrian access via entrance L or N, and that will be for our stage 2 works, and that will go until approximately 2027. Everyone can still continue to use entrance A and entrance J, and if you need to communicate this to any of your patients or visitors, both of those entrances, A and J, have drop-off zones and after-hours access. So just a bit of a plan of what the site will look like from the 16th of December. So you can see the construction zone has now shifted north, and there'll be no access to the campus from Campbell and Forbes Street. So I thought we'd just take this opportunity to give you a bit of an understanding of what stage 2 looks like, because we've been very much focused on stage 1 over the last couple of years. So there's just a couple of renders on the side of what our stage 2 building will look like. Ultimately, we'll see new inpatient units, the Integrated Cancer Centre, including the Australian Cancer Research Foundation OASIS Centre, increased women's and children's ambulatory care spaces, and I'll show you what that looks like in a minute, and enhanced support services. So I'll just get Amelia to pop over to the next slide. So this here is what the building will look like. So the Integrated Services Building Stage 2 is a larger building than the Stage 1 footprint. We have 5 levels, including a 6th level of plant. So you can see there on the basement level, we have some more of our back of house services, including engineering workshops, a satellite kitchen, additional distribution centre, and loading dock. On ground, we'll see that atrium extend all the way north, and we'll see expanded radiation oncology, cancer clinics, our conference centre, that's currently situated on the eastern campus. We'll see some retail outlets and quite a large drop-off, which will be the entrance L drop-off. On level 1, we'll see more haematology ambulatory care spaces, cancer day only, some administration spaces, as well as our new clinical trials unit and our Oasis Wellness Centre. On level 2, as I mentioned, we've got women's health outpatients, EPAS and fetal maternal unit, paediatrics outpatients, some further administration spaces, as well as staff health, infection prevention, infectious diseases, and our library. And then 3, 4 and 5 are our inpatient units, so paediatric inpatient unit, palliative care, postnatal, antenatal, haematology, and oncology, and we'll also see the establishment of the bone marrow transplant unit as well. Throughout stage 2, we'll also see a significant, well, one stage 2 is complete and everyone has been relocated out of Carroll and Chisholm. We'll see significant refurbishment within Carroll and Chisholm across all floors for administration purposes. That's really a bit of a wrap up around what stage 2 will look like. And this is what the final aerial shot you'll see delivered at the end of 2027.
So that is the end of our presentation. So if you get busy and pop in any questions or comments you might have. While you do that, I just wanted to wish everyone a Merry Christmas and Happy New Year. This will be our last REDTalk for 2024. It's been a very eventful year from a redevelopment point of view, very exciting. Lots of really positive comments around the building and the new main entrance. And so very exciting to be working in Liverpool over the next few years. We do though look forward to your continued collaborations by attending the REDTalks and providing comments and also feedback around any things that maybe not quite right or that are really positive. So yeah, thank you. Any comments? Any questions so far?
Yeah, so I've just got a comment. There's a fire stair exit at the eastern end of the Alex Grimson building. What is happening there? So I can provide you a bit of an update whilst there are still people within the Alex Grimson building. So from the 16th of December, the cancer building and pathology building will be handed over to Lend-Lease. However, the Alex Grimson building will still be occupied. So we will maintain all fire egress required. We'll be doing some amendments to the fire egress plans, so you should see those come up over the next couple of weeks.
Excellent.
I was helping a patient negotiate the fencing still up near entrance A in a wheelchair. When will it be taken down? I believe you're referring to the fencing that's around the deck. Hopefully that's correct. So we're just waiting for a date from Lend-Lease as to when they'll be completing those works at the front of entrance A. Another one around a query if we could provide an indication of when the end of trip facilities will be open. So very exciting. We got handover of the end of trip facilities yesterday, so we're now just working with the Director of Corporate Services around opening that space. So either the end of this year or early next year.
No other questions, Corinne?
Yeah, patients still getting lost trying to find clinics, any solutions? So thanks, Eugene. We've put some additional signs up at the end of last week. We're just trying to understand whether that is what will solve the problem, whether it's signage that is the issue or whether it's further information that patients require or whether it's just familiarisation. So we're still working through what that looks like, but hopefully some additional signage will help. Another question, when do we see the library being open and will it be 24-hour access? So the library is in stage 2, so at the end of 2027. Unfortunately, I'm unable to answer whether it's 24-hour access or not. I don't know, Scott, if you're able to.
No, I've not had any conversations about that. We'll work that out closer to the time, I think.
Yeah. Volunteers, yes, Eugene, great suggestion. We have been working with Kirsty around what volunteers are available to help with directions, especially with the closure of entrance L and N. Please ensure good signage. Yes, Jay, we are working through signage. So we will continue to work through what additional signage is required.
Yes. Okay.
Smokers at the front entrance. Just smokers at the front entrance.
Someone has put a comment in around smokers at the front entrance. Yes, been escalated through to the GMU. It's a wicked problem that we haven't really got on, I wouldn't say on top of, but we haven't really got a solution to. Lots of signage was put up in J entrance. Pam, our Acting Director of Corporate Services, is chairing the smoking group at the moment for some time. Certainly an area that, doesn't look wonderful, and we've had lots of concerns and complaints from both our consumers and also our staff. So we'll keep working with that. The LHD are also putting together a bit of a plan with the GM. So yeah, I'll come back to the group early next year.
So just got a couple more questions around the Pathfinders to have keyword searches. So you'll notice in the entrance A foyer, there is a big airport style board that has numbers and the name of the department. We'll also see installed a kiosk over the coming weeks prior to Christmas, which people will be able to do keyword searches on. And it will also be available in multiple languages. So that will be installed in the coming weeks. The other question was, will it always be numbers? The answer is yes. At this stage, it will remain as numbers. I think there is a big piece of work we need to do around ensuring that the letters going to patients have numbers on them. I know I've been in the we're in the atrium where letters that patients have still have old information on it. So my team is working with the clinics around ensuring the right information is going out to patients. But at this stage, yes, it will be numbers.
Nothing else? Yeah. Okay. Well, thank you, everybody. Thank you for the questions. Thank you for your commitment to attending the Red Talks and your interest in Liverpool and the new facility. I hope you have a wonderful Christmas. If I don't see you before then, and we'll definitely resume these sessions in 2025. So thank you very much. Have a great day.